News Now is looking at ways to help you and area businesses overcome the effects of the pandemic and rebound from them. A major part of the country rebounding is the COVID vaccination and its overall effectiveness. 3 News Now reporter Kent Lutzen has more on what health officials say needs to be done even after receiving the vaccine.
Roughly 8.5% of Nebraska's population has received at least their first dose of the COVID vaccine. That's according to the Centers for Disease Control and Prevention. But what happens when that number becomes the majority?
We're hopeful that if we can roll out the vaccine to a broad enough population, get this pandemic under control, that people will be able to start to enjoy some of those things that we all crave so much.
Infectious disease doctor Mark Rupp says the transition period will still consist of masks, social distancing, and other public health measures.
So it is kind of a difficult message for people to fully grasp, and kind of a bitter pill to swallow, that even after we get the vaccine, do we still have to do some of these things? For the short period, I think the answer is probably yes.
Rupp says the reality is there will continue to be low-level spread of COVID-19, even after most have been vaccinated. He adds more research needs to be done about spreading the virus post-vaccination. And a rebound from this pandemic could be interrupted by a growing number of variants, according to Dr. Anthony Fauci.
The vaccines that we're currently distributing right now are quite effective against that particular variant. Less so against the South African, the 351.
Fauci says he's hopeful the United States will get the virus under control by the time other, more serious variants become dominant and widespread. In Omaha, Kent Lutzen, 3 News Now.
Rupp mentions that a new normal may be an annual COVID shot, just like the flu vaccine. He says more research needs to be done on how long the current vaccine remains effective.